this video, I'm going to demonstrate how to aspirate a mass and prepare a slide for cytology. In this case, I have pre-prepared some fake abscesses. The recipe is in another video if you're interested. So go ahead and get a 3 ml syringe, attach a needle. In this case, I actually prefer to use safety needles. And go ahead and insert the needle at roughly a 45-degree angle, although the angle doesn't matter so much. And then go ahead and aspirate. Sometimes you may not get fluid right away. You may have to twist the needle a bit and then aspirate some more. And even though this mass is fairly large, you can see I'm only able to aspirate out a small amount of fluid, but that's all that we need for cytology, so we should be okay. You'll go ahead and snap the safety cap, remove the syringe, set the syringe aside for later, and dispose of your used needle in a sharps bin before we move to the next step. Now that we've aspirated our fluid in our syringe and safely removed our needle, we're going to set that to the side. Go ahead and label a few slides. If you're not going to use a sticker label with a barcode, write the label in pencil. If you use Sharpie pen, sometimes that will wash off in the Diff Quick solution. So go ahead and put a small drop of the fluid right next to the frosted edge of the slide. Take another slide and hold it at roughly a 45-degree angle. Swipe it towards the fluid. Let the fluid run the length of a slide and then swipe it forward. That will make a nice thin monolayer on the edge for the clinical pathologist to review. And repeat that on all of the slides that you have labeled. Now you have a nice slide. You're going to let it air dry, and then you're going to stain it in Diff Quick solution and send it off to your clinical pathologist. Thank you for watching.